When I was 8 weeks postpartum, I had a stroke because I had a bilateral carotid dissection. Everything was going as well as you would expect with a newborn who came a month early. We were starting to settle in about 8 weeks, and I had a horrible bout of food poisoning. And I, at some point, lost vision in the top of my right eye and got like the worst headache ever. I wasn't quite exactly sure what was going on. And later that afternoon, I stroked. I don't remember the stroke at all. I remember bits and pieces of that day, but I don't remember going to Mercy General at all. I remember telling my husband, like, please don't let me die. Like, if I die, I take care of my son. And then they transferred me here to Mercy San Juan. When I got here, I was postpartum, so my body was already going through all the weird postpartum changes. And then on top of that, I couldn't move the left side of my body. So I required a lot of help and just compassion. My ICU nurse went above and beyond to make sure that I received the time with my family, and she worked hard to even make sure that my newborn son was able to be brought into the ICU so I could see him and feed him. They didn't have to do that, but they did, and then they did it in a way that they made sure that my son was protected. They went above and beyond to make sure that I was treated with dignity and respect. So when I was here, I received speech, OT, and physical therapy because I originally couldn't move the left side of my body.
I would say the largest goal for them is mobility and early mobility. We want them as active as possible, as soon as possible. We want them to utilize any active motion that they have.
The last day that I was here, I was able to walk up some stairs, which was a huge step. The whole time I was in the ICU, I had the hope of, I need to go back to teaching. And I remember when we thought that maybe I wasn't going to be able to work again, just saying like, no, I have to work, I have to drive, and I have to be a mom again.
I think the biggest challenge is that their life is dramatically changed if they've had a significant stroke. Learning to understand that their body is not as it was, but that there is a lot of potential to progress and to be able to do a lot of things that they did prior in life, that they just have to learn to do it in a new way.
When I was able to go back to work, I felt a lot better. And it's never perfect. I mean, I still think about the stroke every single day, but I'm able to now go through my day without it debilitating me. Having a carotid dissection is really rare, and then that I had it bilaterally. I didn't have any pre-existing conditions. I wasn't having high cholesterol or any problems, so I should not have had a stroke. When I finally decided to join a group for carotid dissection survivors and realized that there's so little information that people know about this, I started to realize that there's something needed to be done to raise awareness. I wanted to make sure that the community and people around are aware that strokes happen at any age. I'm working with my school district and Dignity Health to bring stroke awareness materials to elementary and middle school students. My outcome was so successful because my family got me help really quickly, and then also the EMS responded quickly, and Dignity also, their doctors got me treatment right away. Thank you for giving me a second chance at my life. Thank you for acting so quickly and being confident in your medical practices and able to give me the help that I needed. There is hope. I am now able to enjoy being a mother. I'm able to go back to work. I'm driving. I'm doing all the things that we weren't sure I was going to be able to do, and I hope that people can find hope in my story.